This is Dr. Roger Knapp, pediatrician. I'd like to talk to you about hives. Now, hives is an allergic reaction and are large, big whelps. They're anywhere from pencil, quarter, even $half size. Very sharp border-edged whelp, and they can be used generally all over the body. If you have just a little bit of a rash in this one little spot, then that's generally not hives. They're usually all over. And infants can have an illness called roseola. And that's where they have fever for 2 or 3 days and then they break out in a rash, little tiny dots, and it's mostly on their chest and back. And that doesn't itch, it's not hives, and not an allergic reaction to any medication given. The infant will have fever and end up getting diagnosed with some kind of illness, and the doctor gives antibiotics, and then they break out in those fine little tiny dotty rash, and they get mislabeled allergic to the medication when they're not. So the hives is a reaction to something inside the body. It's not topical like soaps. And then generally 3 categories. There's more, but generally 3. One is medications. Number 2, it can be foods. Of course, you're aware of peanut butter and eggs and the like. But the more common cause is an infection. You're allergic to a protein in a germ, like you're allergic to protein in eggs. In fact, 75% of adults walking down the street who say they're allergic to a medication are not. Some are, obviously, but there's many people who get mislabeled. For example, I'll see a child running fever at home several days, and the mother wants just to watch it. Then after a few days, the child breaks out in hives, whelps all over, and that scares her, and she brings the child in. Had we seen the child the first day of the fever given penicillin, a couple of days later had hives, and we go, allergic to penicillin, when in fact it was the illness that caused the hives, not the medication. So when they do break out in the hives, I will have the parents stop the antibiotic, change to a different one, but hold on to that antibiotic. And in a few weeks, when everything is else status quo, administer another 24 hours of the antibiotics. And if they break out in hives the second time, then call me and let's label them allergic to the medication. The allergists say that that's safe to do as long as it's just a mild hives and not a more serious and what they call anaphylactic reaction, where the child wheezes, they have difficulty breathing or even pass out. If it's just simply hives, then it's safe to try one more time. Some of the parents are nervous about that, so I tell them to just park in our parking lot or in the parking lot of the emergency room and administer the medication again, and you've got some help right there. But it's hardly ever do I actually hear back from the parents at all that they were allergic. Usually they're not. The other category would be some kind of foods. So when they break out in the hives, if they're on medication, we switch, just like I mentioned. But then we stopped all of the allergenic foods, peanut butter, eggs, seafood, strawberries, more common allergenic foods. We stop those for a week or so, and the hives go away. Then we start putting them back in one at a time to see what might have caused it. And if they're not on any medications, or we eliminate all the foods, we stop and change our antibiotics, and they continue running hives, then we're going to go see the allergist and start running tests. But the allergy tests, they're fairly accurate, but there can be mistakes. And all that does is suggest what to look for, because you could have a test positive to giraffes and you're not around a giraffe. So it's a situation where they give you ideas, well, maybe you're breaking out into hives to your breakfast cereal or milk or bananas. And so what are you going to do? Eliminate that food and see if the hives go away. Most allergists actually say if you actually have to challenge them up to 3 times, and all 3 episodes you challenge them with that food, they break out in hives, then they're allergic. So careful you don't get mislabeled allergic to something and you're really not. This is Dr. Roger Knapp. I hope you learned something there.